Good morning. I am Connie Ray, and I'm honored to be your host for Crisis Support Services of Nevada's fourth annual Compassion Through the Crisis. The virtual format may look a little different this year, but the goal of the fourth annual Compassion Through the Crisis is still the same. We are here today to highlight the invaluable services that Crisis Support Services has provided 24 hours a day, 7 days a week, 365 days a year. The collaboration being done to develop Nevada's crisis care response system, and how you can help us build a system that will support Nevadans and others struggling with a behavioral health issue. We are thrilled and honored this morning to have with us Governor Steve Sisolak to join us and start us off this morning. Please welcome Governor Steve Sisolak.
Good morning, and thank you for having me this morning. And I want to welcome all of those attending the fourth annual Compassion Through the Crisis virtual event. I'm honored to be able to speak with you briefly today, and thank you for the important work that you do on a day in, day out basis. Crisis Support Services of Nevada has been saving lives in Nevada for more than 50 years. Your service to Nevadans reaches every corner of the state, urban, rural, and everywhere in between. When COVID hit Nevada, Crisis Support Services of Nevada immediately joined the Nevada Department of Health and Human Services to provide support for Nevadans struggling through this crisis. And we've had an increase in the number of those who have struggled. The COVID pandemic clearly showed us the importance of implementing a unified crisis care response system. As air traffic control hub of Nevada's future coordinated crisis care system, Crisis Support Services has been diligently collaborating with law enforcement and other first responders, providers, and human service officials to begin standing up to this crucial system. Crisis Support Services continues to provide a safe place for Nevadans who have lost hope and feel that suicide is the only way to end their pain. Suicide is the second leading cause of death in teenagers and young adults behind accidents. Our first responders are dying by suicide at a higher rate than by being killed in the line of duty. Our elderly, LGBTQ population, and many others are struggling as well as we navigate our way through this pandemic. CSSNV staff and volunteers provide Nevadans hope and a safe, non-judgmental place to turn in their darkest hours. And they do this 24 hours a day, 7 days a week, 365 days a year. They're there all the time to help our citizens. Thank you for joining me, Nevada's legislators, staff, in partnering with Crisis Support Services of Nevada as they continue to support Nevadans that are in crisis to find the services that they desperately need. Thank you all for being with us today, and even more importantly, thank you all for all that you do.
Thank you so much, Governor Sisolak. Thank you for your kind words, your generosity, and for kicking off this morning's vital Compassion Through the Crisis event. And we thank you for your constant leadership and support through one of the most catastrophic pandemics in modern history. Right now, I'd like to introduce to you CSSNV's Executive Director, Rochelle Pellisier. She's here to talk to us about CSSNV's past, present, and future.
Good morning. Thank you so much, Governor Sisolak, for getting us started today. We are honored to be working with you to support Nevadans through some of the darkest hours of their life. As Connie said, I am Rochelle Pellisier, and I have had the privilege of being the Executive Director of Crisis Support Services of Nevada for almost 5 years now. I want to thank all of you for joining us so early in the morning to attend the fourth annual Compassion Through the Crisis event. The board and I are so pleased with this turnout of support for Crisis Support Services of Nevada and those we serve. CSSNV has been saving lives for more than 54 years. The organization was established in 1966 in response to the high rate of suicide in Nevada. Working with Northern Nevada Adult Mental Health Services, a plan was created to establish a 24-hour suicide prevention hotline. This was really quite amazing when you remember that in 1966 there were no cell phones and only one phone per family. Back in 1966, Nevada had the highest rate of suicide per capita, and we kept this unfortunate #1 position until the year 2000. In the last several years, we have moved out of the top 10 to number 11 twice. Unfortunately, this seems to have been a blip, and we are now back to the top 10 today. Our first office was in a phone booth in the UNR library. How many of you even remember phone booths? We were established on April 1st, April Fool's Day. Obviously, the pioneers who dreamed of and started the Crisis Center, as it was called back then, had a sense of humor. The organization started out as an all-volunteer hotline. Back then, volunteers took the calls at home. When the phone call came in the middle of the night and there was a need to dispatch emergency personnel to help someone who was suicidal, the volunteer would send one of their kids or spouse next door to the neighbor's house to call the police. That was back before 911. In the first few months of operation, the need for our services proved to be so great, it was expanded to include support for any persons in any type of crisis. We have learned that people don't just wake up one day and think, I'm going to kill myself today. There are many different traumas and issues that lead to that kind of pain. In 1979, the center again expanded its services by adding an advocacy program for victims of sexual assault. We have been advocating for those who have been sexually assaulted in northern Nevada for more than 40 years now. Crisis Support Services of Nevada operates 24/7, 365. Our funding is primarily through federal and state grants, so all of our services are free of charge to those who contact us. Now our diverse, well-trained, and dedicated volunteers and staff members help those in crisis to make safety plans and dispatch emergency services to those in imminent danger, both in Nevada and all across the United States. CSSNV is one of 9 national suicide prevention lifeline call centers. All calls to the lifeline from Nevada come to our center first. We also get the calls that roll over from 166 other independent centers across the nation when they are unable to answer all of the calls from their region. CSSNV was contacted over 83,000 times last year, both through phone calls and text message. We were one of the first crisis centers in the nation to implement a texting service for crisis intervention, immediately getting response from youth ages 10 to 24 who would not have called in for help, but would text in a crisis. Of those 83,000 people we helped last year, over 9,000 were via text message, primarily from children. Just about 20,000 of those contacts were from Nevadans. As I said, we take care of the whole state. 25% of those calls and texts were from Washoe County, 31% were from Clark County, 18% were from the rural counties, and the other 26% were from unknown areas in Nevada. We helped over 11,700 callers who were victims of current or historic child abuse. We took 2,320 Child Protective Service reports. We helped 713 callers who were victims of elder abuse and took 313 elder abuse reports. We also helped 1,874 adult victims with disabilities, took reports of abuse, and ensured that those reports got to the appropriate authorities. That is a lot of numbers, but let me put a face to those people who contacted Crisis Support Services of Nevada. It was the Carson City Middle School 6th grader who, after participating in Signs of Suicide, where our wristbands, pencils, and stickers with our phone number were distributed, told a counselor at her school that she had already called us 3 times, and that is why she was still alive. That one hurts my heart, but thank God she called us. We know that teens will reach out if we give them our contact information. just like the Sparks middle schooler who reached out to us when she saw a Snapchat that 14 of her friends had a suicide pact and were planning to kill themselves the next evening. Because that child contacted us, one of our UNR social work interns was able to dispatch the appropriate people to help those children. We have to get our children the tools they need to help themselves and others. Crisis Support Services of Nevada should not be the best kept secret in Nevada. It was the housekeeping staff member who worked in a New Jersey hospital emergency room during the height of COVID, who called because he had seen so much death and didn't feel like he could do it anymore. It was the person calling from Washoe County about an adult with disabilities who was being abused by his caretaker. This came in during the graveyard shift a couple of weeks ago. The abuse was so bad that not only did we take a report, but we also dispatched law enforcement to have that caretaker immediately removed from the premises. In the same graveyard shift, it was a Las Vegas man on the sex offender database who called because he was offending again. We got that man the help he needed from Las Vegas PD, and he was taken into custody before our graveyard shift was over. It was the 911 dispatcher who had attempted suicide the day before and was still struggling. We were able to de-escalate her and then get her to safety with her adult daughter. Not all of the people we helped were over the phone. Sexual assault support service volunteers Not all of the people we helped were over the phone. Sexual assault support service volunteers and staff advocates provide services to all victims of sexual assault in Northern Nevada. Last year, our organization assisted 500 assault victims and their families. These services run the gamut from meeting with the victim immediately after the assault, dispatching the forensic nurse to do the exams of those who were sexually assaulted, being present and providing advocacy during the forensic exam, facilitating victims' assistance, and following up with the victim for up to 6 months. We do our best to help the victims of these heinous assaults to not only become survivors, but hopefully become thrivers once again. This last year, we have been working very closely with the Nevada Department of Health and Human Services, law enforcement, and other first responders, as well as providers of behavioral health care to implement a statewide crisis care response system. A crisis care response system saves lives by directing people to the appropriate services at the appropriate time in the appropriate place. Before now, if you were having a mental health crisis, we would send emergency personnel, mainly law enforcement. Law enforcement would transport the person to the emergency room where they would have to wait with that person in crisis, sometimes for hours, before they could get back out to serve others in the community. The emergency rooms were left with a patient who may or may not have needed that level of care. A crisis care response system not only saves lives, but it also saves resources. When Maricopa County in Arizona implemented the Crisis Now model of crisis intervention, after the first year, because law enforcement were able to get people to the appropriate level of care, get back to duty, and not have to wait in the emergency room for hours, the county saved the equivalent of 37 full-time police officers. And they also saved $37 million by diverting people away from emergency rooms to more appropriate services. The COVID outbreak showed us how much we need this kind of crisis care system in Nevada. Never did we need a coordinated system more than during the initial phase of COVID, when we could not send people to emergency rooms when they were having a behavioral health or suicidal crisis. We know that we don't have enough behavioral health services in Nevada, so it is even more important that we coordinate the services that we do have. I will leave you with a quote from John F. Kennedy. The Chinese used 2 brush strokes to write the word crisis. One brush stroke stands for danger, the other for opportunity. In a crisis, be aware of the danger, but recognize the opportunity. Nevada has an opportunity right now. If we all collaborate, we can ensure that we use our limited resources and services more effectively so that those in crisis get the appropriate intervention. We can then reinvest the resources and funding that we save through this collaboration into more services that are so badly needed across our state. Crisis Support Services in Nevada has always been aware of the danger of losing our loved ones to the opioid and suicide epidemic that has been ravaging our nation. But we also recognize the opportunity to work with all of you to help people to see that there is hope and that can be a better tomorrow. I want to again thank you for joining us today and look forward to seeing you in the future. I'll throw it back to Connie now.
Thank you so much, Rochelle. I'm always amazed at the accomplishments of the CSSNV staff and the volunteers. They are incredibly dedicated to helping our community survive through any crisis, whatever crisis that may be. One of my favorite projects of the year has been hosting CSSNV's Talk It Out Tuesdays. It started out as a weekly interview series where CSSNV partnered with experts across the state to dive into issues concerning our mental, physical, and spiritual well-being during the COVID-19 pandemic. Talk It Out Tuesdays went over so well that we soon decided we would go to a monthly format and talk about trending issues that were causing conflict. It is well known to conflict. This is the premise of Talk It Out Tuesdays. Looking back on our first episode where we went from planning to recording in 3 days, you can see that we did have a few sound issues, but we have much better in our last 11 episodes that we have done this year. I am incredibly proud of these 15 to 45-minute episodes. We'd like to share with you a small glimpse into a very big, compassionate idea. So that brings us to our very first Talk It Out Tuesday episode, Home But Not Alone.
The Crisis Support Services is also a place where you can go for just someone who can be caring and compassionate on the other end of the phone to listen.
And I am so excited to be the moderator for our second episode of Talk It Out Tuesday. And we are going to be talking about supporting teens and young adults through COVID-19.
Everyone's going through some sort of anxiety, and we shouldn't put that pressure on ourselves to do something every second of the day.
Everyone is talking about kids because kids are our present and kids are our future.
So we thought we would talk about domestic and family violence through COVID-19.
How do we get to those victims? How do we let them know we're here to help, and we can get you out of those situations?
And in our fourth episode of Talk It Out Tuesday, we are going to be talking about the impact of the pandemic on multicultural populations.
And the opportunities really for us is, especially among those communities of color, many of them are essential workers.
In our fifth episode of Talk It Out Tuesday, we are talking about the impact of the pandemic on our frontline healthcare workers.
What people are experiencing now are heightened levels of anxiety, similar to what you might experience kind of going into a battle.
And in this episode of Talk It Out Tuesday, we are discussing how the impact of this pandemic has raised some new concerns for our veteran populations and also heightened some existing issues. You have served this country and you are an absolute hero, and it's okay if you need help.
Don't be afraid to reach in. Call that battle buddy or that veteran you haven't talked to in a long time from your unit. Rekindle some of the good times that you had together. This is a photograph of myself, my brother Adam.
So this is Katie and her husband Sloan, and this is their wedding photo. Would have been 26 today. In this episode of Talk It Out Tuesday, we are discussing how the state of Nevada has recognized and responded to concerns that are arising for our older population in our communities.
And really just trying to be kind and patient with one another and understanding that everybody has a response that's a little different. And for those folks that are older or have underlying health conditions, this can be a very scary time for them. And so we all need to be patient and kind with one another during this process.
Hello, I'm Connie Ray, and I am excited to moderate this very special episode of Talk It Out Tuesday, the culture crisis, a necessary conversation.
The greater majority, which is white America, and I'll just say white individuals in our community, they're listening.
It's caused us to truly have those tough conversations, look at our internal office, where do we sit in the community, because ultimately we serve this community.
Creating change between law enforcement and the community.
And so let's focus on the commonalities, which are that, for example, the good police officers don't want bad police officers on the force any more than anyone else does. So let's focus on trying to find policies that help to root out those who are sullying the name of our police officers. Part of the systemic racism that we have to address. It's not just in criminal justice, it's not just in education, it's also in employment, it's also in housing, it's also in other components of economics.
I am Connie Ray, and I am the moderator for this episode of Talk It Out Tuesday, developing Nevada's crisis care response system.
We want a system that allows for people, if they're having a bad day or they're having a mental health crisis, to have someone to talk to right away.
So there's less resources, less providers, and there's a smaller population base.
With September being Suicide Awareness and Prevention Month, this 11th episode of Talk It Out Tuesday, we wanted to discuss the history of suicide in Nevada and where we are today.
We have a long history, unfortunately, in Nevada of these high rates of suicide.
We call those invitations could be behavior, appearance, mood, and they're numerous, of course. So the easiest thing to think about is any change from that person's typical self.
I just, again, encourage anyone to contact Crisis Support Services of Nevada for support and to find services in their area. If you would like to watch our 11 episodes of Talk It Out Tuesday, we do invite you to visit the website cssnv.org. I can tell you each one of them is filled with a plethora of information and vital resources. Our first responders have seen a lot this year. Already, they were dealing with life and death issues on the front lines. This morning, we have two first responders to talk about mental health struggles and the prevalence of suicide in our first responders. Our first speaker is Washoe County Sheriff's Officer Sergeant Randy Wouters. He is one of the supervisors of Washoe County Sheriff's Office Crisis Intervention, Stress Management, and Peer Support Team. Please welcome Sergeant Randy Wouters.
My name is Randy Wouters, and I have been with the Washoe County Sheriff's Office for almost 21 years, where I'm currently a sergeant working with the Detention Services Unit. During that time, I have worked within our jail and as a patrol deputy, and a detective. I also spent 12 years on our hostage negotiations team, was a crime scene investigator and a field training officer. Moreover, I recently retired from the United States Coast Guard, where I served 24 years, had 3 mobilizations since September 11th, 2001, and was on the Pacific Area Crisis Intervention Stress Management Team for the Coast Guard. More importantly, as it relates to the topic we are discussing today, I've spent over 18 years on our crisis intervention, stress management, and peer support team. I have attended numerous training classes regarding crisis intervention, suicide prevention, and trauma response, and I am currently one of 2 supervisors for this team. I'm a unique member as I obtained my master's in social work from the University of Southern California. I went through their clinical track, which provided me with an in-depth understanding of mental health, recognizing causes, signs, and symptoms of disorders, care for mental health and concerns, and treatments. Additionally, I was taught a thorough understanding of social work and how to seek out and provide support to various communities. All of this was accomplished with the support of my 3 children, who are now 14, 16, 19, and their mother. I'm here to speak with you about the superheroes I regularly work with that don't wear capes. Why superheroes? All of us have jobs or careers that we are dedicated to, whether it is just to pay our bills or something we are truly passionate about. We have something that gets us out of bed every day to go and interact with the world. We have families we are responsible for, friends we interact with, and people who have some effect on the way we live our lives. Every one of these interactions affects how we do our job and how we interact with the world. Be it in a positive or negative aspect, it has an effect. If I get up in the morning and happily kiss my children goodbye and they reciprocate that feeling and gesture, it sets me up for a good, positive outlook for the day. Then, on my way to work, I have that person who may not be paying attention and cuts me off, and that has a negative impact on my mood and behavior, and I now take that to work. You get the point. Every relationship we have and every stressor, good or bad, affects us, our mood, and our interactions within our profession. The superheroes I work with are not immune from that. They are people just like you, moms and dads just like you, friends just like you, professionals just like you. Where they earn their superhero status is the work they do, the professionalism they maintain in the face of that work, and the ability to do it many times throughout a work shift, throughout many days, months, and years, even in the face of adversity and negativity. They wake up and they go back to protecting and serving their community, who seems to ask more and more of them every day. Their workday consists of traffic stops, traffic accidents, child custody issues, domestic violence, fights, robberies, weapons and drug-related events, natural deaths, and felonious death, just to name a few. Conversely, they're engaged in community activities such as volunteering at local elementary schools, raising money for various charities, trying to find community providers for people suffering from homelessness, addictions, tragic life events, and a myriad of other social need programs. These superheroes maintain the same professionalism no matter whether they are dealing with a murderer who is actively fighting them, helping a lost child find their parents, or giving a special needs child a drive-by parade with a marked police car during the COVID pandemic. There is the shift work aspect of the job. Some officers work abnormal hours because law enforcement must be immediately available 24 hours a day, 365 days a year. The calls for service and criminal behavior do not occur only during daylight or day shift hours. Furthermore, especially with the midnight shifts, they are often woken up during their sleeping hours to go to court, or if they are a part of a special team needed to respond to critical situations. According to the 2019 FBI statistics in officers killed in the line of duty, 48 officers were feloniously killed and 41 were killed in accidents. That's 89 officers that are killed by actions other than their own. Conversely, 285 officers died by suicide in 2019. This number does not account for the officers who put themselves in precarious situation because their will to live has diminished, or other officers who have died by suicide but their death has been reported as otherwise. Law enforcement has seen an increase of about 7 suicides per year since the 1990s. While suicide is the ultimate loss of an officer from the profession, many simply retire, quit, or find a new profession due to our new unique stressors. Many of these retired officers continue to struggle as a result of their profession. Until very recently, there has been a reluctance of officers to seek assistance in dealing with the traumas and stressors of this profession. There have been in the past, and to some degree still is, a stigma that because these superheroes are the helpers of society, the trauma, stress, and other things affecting their psyche should not affect them, making it hard on these officers to ask for help. Another reason is the belief that if these events cause you problems, you cannot be depended on and are quote-unquote unfit for duty. When put on a fit for duty status, an officer is placed in another assignment, forced to undergo mental health evaluation, and in some cases forced into other work because of the belief that they are no longer capable of fulfilling their duties as an officer. Many mental health studies prove this stigma as inaccurate and detrimental to the longevity of officers. If you are curious, an officer dies about 7 years earlier post-retirement than other municipal workers. Because of this stigma, officers have been and continue to be reluctant to seeking help for their naturally occurring concerns. Some additional statistics: 10 to 15% of law enforcement officers are documented as having post-traumatic stress disorder, which is believed to be significantly lower than the actual percentage of those with PTSD. The average age of officers committing suicide is 42, and the average number of years on the job is 17. 53% of law enforcement gets less than 6.5 hours of sleep per night, compared with 30% of the general population, and 40% of them have some type of sleep disorder. While the majority of the population deal with death and trauma on an occasional basis, law enforcement deals with it regularly. To give you an example, our agency has an officer who has been to 48 calls for service dealing with death, traumatic or natural disasters. We have a team that is trained to respond to the most horrific of traffic accidents. Our SWAT team responds to people in crisis and varying stages of trauma, serve high-risk warrants with people actively fighting, active assailants at events with many people such as schools. There are other teams that respond to riots where community members are yelling at them and throwing objects, or respond to an inmate in the jail who has covered themselves in feces and is wanting to hurt themselves or others and needs to be forcibly removed from a cell for their safety and placed in restraints. These types of teams exist in many agencies across the country, and the traumas they experience, while never the same, are very similar. As the superheroes respond to these calls, you can imagine the stress and preparedness they are going through to prepare for what might happen when they get there. They must prepare for the most stressful situation most people will ever experience. While some of these examples are extremes, trauma is a personal experience, and no one experiences it the same way as another. The level of trauma law enforcement experiences from these daily activities is completely based on the officer's history, life experiences, resilience, and training. These superheroes regularly test how resilient they are. They are tested many times a day, week, year, and throughout their career. Over the last several months, law enforcement has seen an assault on its foundation. In today's social environment, law enforcement professionals are not often referred to as superheroes. These messages that are broadcast over and again negatively affect us and our families, building on our already stressful profession. Many officers must deal with the ramification of what feels like an assault on the law enforcement profession, as well as the reaction to current events and how their family and friends react to them and the situation. I have had to talk with officers who have had family and friends sever connections with them over these issues, not because of who the officer was, their behavior, or because they acted inappropriately, but because of their profession. Law enforcement has the added burden of enforcing state mandates with the response to the COVID-19 pandemic. They are being requested to coordinate and enforce shutdowns and stay-at-home orders, make mask mandates and other social distancing protective measures, with staffing that is typically already below minimum levels. In addition, they are having to protect their own family and themselves from possibly contracting the illness. I have personally spoken with officers and their families regarding the concerns for safety during these times. Members who have been in service for over 20 years, been through highly volatile situations, high-stress call-outs, and these times have been the hardest and most disheartening times of their career. The media outlets are regularly reporting the massive numbers of officers deciding to retire earlier than they had intended to, due to this environment. These times will have long-lasting effects on this noble profession. All of these issues take a toll on these heroes' mental health. It is critical to assist these superheroes in mitigating the outcome of and reaction to these stressors. Today, the Washoe County Sheriff's Office has a peer team of approximately 30 people and a SISM team of about 8. We are working closely with the Northern Nevada Peer Support Network and our brother and sister agencies teams and our community support organizations to help bring mental health services to first responders and assist them in addressing the significant events they regularly witness throughout their career. Many agencies, especially large ones, have similar services to these to ensure that these officers and other first responders receive the necessary assistance they desperately need. These are examples of the resources that the Washoe County Sheriff's Office has and is providing to assist to its personnel in order to further reduce the stigma and trauma of their professions. These vital services are completely anonymous and provided openly without monitoring the threat of retribution for seeking help, thus perpetuating that stigma. Bringing a semblance of normalcy to the reactions and secondary trauma from their jobs helps officers, first responders, to have a prosperous career and home life. I would like to leave you with this. These superheroes, while experiencing some of the most horrific aspects of life, also experience some of the best. They get to experience the highs of saving a life, seeing the downtrodden in society succeed, seeing a child reunited with a family, and helping people in their time of need. They get to experience the camaraderie of teams most experienced by members of the military or tribes. They get the privilege of serving their friends, neighbors, and community, and helping people in need. The career these superheroes have chosen is a very rewarding one that has the potential to come at a severe and long-lasting price. We need to continue to break the stigma of talking about mental health issues and stop the prevalence of suicide in our first responders to ensure that we can keep our community safe. Thank you so much for allowing me to talk openly about the issues that me and other first responders deal with every day. By talking about these issues, we can better help these superheroes so that they can continue to serve ours in your community. I will send it back to Connie.
Thank you so much, Randy, for sharing with us the struggles that law enforcement live with every single day. We want to do all that we can to support our officers, and thank you for your service to our community. We certainly appreciate your willingness to share these stories, as well as the work that you're doing to support those in law enforcement. Next up is Adam Hines. Adam is currently the Executive Director of Integrated Health for REMSA. In addition to being a nationally registered paramedic, Adam is certified as a Nevada State EMS instructor and an advanced emergency medical dispatcher. Please welcome Adam Hines.
Thank you, Connie. My name is Adam Hines, and I'm happy to be here today. A little bit about my background. I started at REMSA, the Regional Emergency Medical Services Authority, in 2002 as an EMT. While attending the University of Nevada, I also completed my studies and coursework in paramedic education at REMSA's Center for Pre-Hospital Education. I then worked as a paramedic on the streets of Washoe County for about 5 years. After that, I held an EMS supervisor position and then worked as the manager of clinical standards and practices. I moved on to become the director of our clinical communications center and ran our medical dispatch with our medically trained emergency medical dispatchers taking 911 calls. Today, I'm the executive director for Integrated Health. In this role, I oversee the organization's innovative programs that are focused on providing clinically excellent, compassionate patient care in a variety of out-of-hospital settings. While often deeply rewarding, working in emergency medical services can also be difficult. We encounter people on what is likely one of the hardest days of their life. Many are feeling vulnerable, scared, unwell, and uncertain. And as a healthcare provider, it's our responsibility in that moment to keep them calm and offer words of encouragement and compassion. At the end of the day, where a paramedic can run between 12 and 16 calls, each call taking about an hour, can leave them exhausted, physically and emotionally. As Sergeant Vatraz just mentioned, along with these day-to-day challenges, lately our work has been compounded by this global pandemic, where we are seeing people who are very sick, and we are concerned about their safety, the safety of our colleagues, and the safety of our families. All of these stressors can quickly begin to feel overwhelming. This is why, as a community, we must ensure that first responders, what we have come to call essential workers, are encouraged to process their emotions in a healthy way. I know, as a father of 2 beautiful children and a husband to an emergency room nurse supervisor, I rely heavily on the support and connection with my family. I'm so fortunate that my wife, who also works in emergency medicine, can understand the impact of a difficult call or a hard day in the field, clinically and emotionally. In addition, having children has greatly enhanced how I interact with patients, especially children and parents. I can empathize with them in a meaningful way when their child is injured or sick. because the cumulative impact of the work like this can be difficult to recognize. It's important that leaders, colleagues, and organizations implement processes and programs that are easily accessible and can flex to meet the variety of needs of those on our front lines. REMSA offers a peer support program, generous and flexible personal time off for physical and mental health, first responder yoga, an open door policy with a leader, anytime, any place, as well as an employee assistance program that offers mindfulness training. In addition, all of our providers can take a time out at any time during their shift if they need to kind of reset after one of those tough calls. Even with these many mental wellness options that are available to our employees, they're rarely taken advantage of. While there has been some progress on destigmatization of post-traumatic stress syndrome, depression, and anxiety, those stigmas continue to linger. Normalizing these feelings and emotions, proactively checking in with friends, colleagues, and family members who, based on a career such as EMS, might be at an increased risk for emotional distress, are so critically important. I feel fortunate that in my role as a leader in out-of-hospital healthcare, I'm able to influence and guide organizational decisions to support technological advancements that can enhance access to meaningful mental health care in a more immediate and personalized way. Currently, REMSA is working with vendors to monitor the cumulative effects of job-related stress and to track and trend data on burnout, trauma, and fatigue in real time. Together, we must end the shame and the judgment that healthcare and public safety first responders have felt for too long. These essential workers show up day after day when it's blazing hot, when it's freezing cold, when it's smoky, in the middle of a global pandemic. They're tired, they're weary, they're scared. They wear respirators for over 12 hours of every single day, and they care for patients and our community members during their toughest moments. They take care of us. It is crucial that we do everything we can to take care of them, particularly when it comes to their mental health. I'm so thankful and appreciative for the opportunity to talk with you and be a part of this awareness campaign. Next, Connie will share with us a personal story.
Thank you so much to both Adam and Randy for talking to us about the daily challenges our first responders are facing and how our community can support them. CSS Envy is currently starting a new outreach program for our first responders. They are always there when we call upon them for help, and now we can reciprocate. Stay tuned for more information as this program will be coming in just a few short months. Why am I connected to Crisis Support Services of Nevada? Just about a year ago, I had started a challenge in Northern Nevada. I had challenged businesses in the community to display the suicide prevention hotline number on their business. The idea was to spread compassion, letting community members know that there was always someone listening. There was always someone who cared. Why was this challenge so important to me? On August 10th of 2018, my family's world was shattered. My 24-year-old stepdaughter, Katie, a veteran, a wife, and a mother of 3 young children, took her own life. It is a pain that you can barely describe because as I tell you this story, my body is taken over with emptiness. Losing a child to suicide is like losing a piece of your soul. It's gone forever. There are so many unanswered questions. Katie was so loved. She seemed to have it all. She was beautiful. Katie was successful. Katie did have her struggles. She had suffered from mental illness. She was dealing with postpartum depression. She was a child who grew up with a mother who suffered from addiction issues. and she was drowning, but she wouldn't reach out. Weeks following Katie's death, we had learned that there were many signs. She had even talked about suicide with a friend, but she had told her that she would never do that because she loved her babies so much. Our family, as well as Katie's friends, never recognized those signs. How could we have missed them? Since my work with Crisis Support Services, along with Suicide Prevention Network, I have since taken the Safe Talk Suicide Alertness Workshop, and it is a brilliant tool. But the biggest tool is knowing that there is always someone there to talk to know that there is always someone that is willing to listen. Crisis Support Services Nevada and that 1-800 number are a lifeline to people in crisis. The call volume since the pandemic has been staggering. Our community needs us now more than ever before. For our family, we never thought that we would be in a position that we are in today. We belong to a club that no one wants to be a member of. Katie is no longer with us, but her memory will live on through her children and through our work. Our hashtag is #for-Katie. For those struggling, Crisis Support Services of Nevada offers comfort. Those conversations, they bring clarity. The person on the other line is the lifeline for those in crisis and for those who are concerned for friends and family who are in crisis. I still believe that the more we continue to let our community know that 1-800-273-8255 and Crisis Support Services of Nevada is a lifeline, the more lives we will save. As you all know, Crisis Support Services of Nevada is a charitable organization helping all Nevadans and people across the nation. Please consider donating to this organization. You have done so much simply by being here today, and we've made it very easy for you to donate. You can text the words "For Hope" to 202-858-1233 to donate. You can click the register and donate button on our event page. You can also go to cssnv.org's website. Just push that donate button. You can also send us a check, CSSNV, P.O. Box 8016, Reno, Nevada 89507. Please take a moment right now and donate. If you can't donate, there is always volunteer opportunities on the board of directors, crisis call lines, or sexual assault support services. We will send you the information on how you can volunteer for any of our events. The CSSNV Board of Directors and staff would like to say thank you to our sponsors this year. Sierra Air has been a 3-year supporter of our events. Thank you so much to them. Meadows Bank, a 2-year supporter of our event. And we're welcoming for the first time Circle of Compassion sponsor, the Half a Dime Mortgage Team. Thank you all so very much for your support. Right now, I would like to introduce Lisa Marie Wand. She is CSSNV's board president. She's going to leave us with some final thoughts.
I want to personally thank each of you for attending our virtual event this morning. Our organization consists of a dedicated group of volunteers, staff, and board members that keep our call lines and services available 24/7, 365 without interruption. Knowing the availability of the crisis line and other services we provide equips you with information that saves lives. Valuable information you can share if you feel someone you know may benefit from access to a trained person to listen and support in a time of crisis. I have deep gratitude for our team and the mostly unseen impact we have locally and nationally by offering our critical services around the clock and managing to do so successfully on a budget. I would like to express my heartfelt gratitude to each of you that have participated in this organization now and in years past. The intention of CSSNV includes helping as many people in crisis and saving as many lives as possible, to continue widening our reach and impact in the community, across the state, and across the country, and to provide our clients the opportunity for a better tomorrow. On behalf of our entire organization, thank you for sharing part of your morning with us. I would like to thank the Governor Sisolak for his support, as well as Connie Ray and team for assisting with preparing the event today. A big thanks to our interns, volunteers, and staff of Crisis Support Services of Nevada for all of their efforts coordinating this event. And a heartfelt thank you to our sponsors. We cannot continue this important work without your willingness to be our champions. We ask for your continued support to ensure the organization will be here to provide the critical connection necessary so anyone can reach out in times of need or crisis. We hope that your attendance this morning will inspire your support of CSSNV throughout the year and encourage you to join us at our next event. Thank you.
Thank you so much, Lisa Marie, and to the board. We appreciate all of your help. And thank you for joining us for the 4th annual Compassion Through the Crisis virtual event. Thank you so much for supporting Crisis Support Services of Nevada and helping us make this event a huge success. We look forward to seeing you in person next year. We also want to say a very special thank you to Governor Sisolak and all of our wonderful speakers. We hope to see you next year at the 5th annual Compassion Through the Crisis in person. Thank you so much and have a great day.